Hi guys. The topic that I chose for my research was substance abuse in women in relation to trauma, and kind of just looking into why gender matters and how it can affect women differently. Um, the facility that I chose was the Odyssey House, specifically the Family and Children's Residential. I wanted to choose Odyssey House because they are a nonprofit organization. They work with a lot of low income individuals, people that are on Medicaid, and they do also work with a lot of homeless people and people in severe poverty. And for those groups, they can actually offer free services that'll help with the treatment rates. And then with women specifically, they'll see more people of color, but they do have a very diverse range of people that come in. And they're seeing them about age 20 to 35, kind of right when life's getting a little more serious and have a lot of things going on and getting more stressed out, I guess. um, this first article that I had found is talking about adverse childhood experiences and traumas that lead to substance abuse. They found that women are more likely to have ACEs. Um, and when they do have ACEs, if they have four or more, it can increase the drug use about 2 to 4 times. And then in this trial specifically, they interviewed 19 women that were in jail or on probation, and they were in there due to their substance use issues. They found that 62% of them had four or more ACEs, so they were already more likely to be using substances, having trauma, um, coping coping with substances for reasons like that. Um, this second article is talking about they kind of talked about which treatments would work best for women. They were trying to address substance use, interpersonal abuse, and PTSD together. In certain areas, women were seeking out um, domestic violence support, and they were also using substances at the time, so they would be getting turned away because of that substance use. So in this article, 14 practitioners were interviewed, and they addressed the importance of treating them all together as one thing rather than separate issues, because they do go hand in hand. They found that 40 to 70% of women using substances had some sort of interpersonal abuse or childhood trauma. And then a lot of them did also have PTSD symptoms as well. And then during my interview, I had asked, what are some of the common reasons that you see women coming into treatment for? And um, trauma is typically the the number one. Um, and then I was like, what barriers? Why are they not coming to treatment as often? Because the um, the rates of treatment for men and women are way lower than men. They're about 37% treatment rate. A lot of the time, they are struggling with choosing between their children and treatment because a lot of facilities won't take children. Um, and so, they're concerned like, if I go to treatment, what happens to my kids? I don't have that support. Are they going to go into DCFS? Are they going to be in the foster care system? Stuff like that. And then sometimes they're going through child custody, and they're concerned that if they get treatment that they might the court system will look at people like this a lot of the time and deem them not fit to be a parent. um, and then single moms a lot of the time are struggling to get treatment because they're either working part-time, and because they don't have that support, they're concerned about losing their job, losing their home or car, and they can't afford it. And then, if they're working part time and they can't afford it, they're not going to go. But if they're working full time, a lot of the time they're right above that borderline of income maximum, and so they can't receive the benefits. So they can't receive benefits and they can't afford the treatment. Um, and then a lot of the time, women, about 69% of families in Utah are headed by women. So like time-wise, they're not really feeling like they don't have the time to step away and get the treatment because they're taking care of their families a lot. Or in some situations, the partner is the dealer. So they're kind of in that tricky situation too. And then, if even if they do step away and they get the treatment, and then they go, they get out, are they walking back into that same situation, same environment? And, it could heighten the chances of them going into relapse. So they just avoid it altogether. Um, and then another reason that women typically use substances is that they are pregnant. And that is kind of unfortunate. But, they're having a hard time managing their emotions, like hormone fluctuations, life changes, stuff like that. And also during pregnancy, the rates of domestic violence and abuse are increased. So they're also using to cope with that trauma as well. And then, after pregnancy and they're going into motherhood, a lot of the time they're struggling with meeting the expectations of what a mom should be, or having those stigmas, and, having all of the schedule things that they're having to meet, taking kids to practice or PTA meetings, mommy groups, stuff like that. And so a lot of the time they're using stimulants to cope with stuff like this. About 70% of the women that they saw admitted for treatment had dependent children. Um, and those women were using methamphetamine to kind of help them stay awake and do the things they need to do. And then they will also see a lot of women on antidepressants. And once they don't have the antidepressants or they're not taking them, they're falling back on other substances. Um, Kind of like I mentioned before, there is that stigma of substance use that is preventing them from getting treatment as well, because like they don't want to be seen as weak, and that's kind of how society views people with substance use treatments. Another reason that they're having issues is lack of domestic violence shelters, homeless shelters, and outpatient programs, mostly in Utah County, but also in rural areas, Wasatch County, Davis County, and then they'll even see it all the way down to St. George. And they're not able to support these women, so a lot of the time they're getting sent up to Salt Lake, and Odyssey House is receiving a lot of these people, and they can't support a whole state of people seeking treatment. Um, I also asked which treatments that they had seen work best for women, because they do respond differently than men. Um, the one thing they focus on the most is women's empowerment. So these can include domestic violence survivor groups, teaching them how to hold boundaries and develop boundaries, and then, encouraging them to have the ability to do things on their own. Um, not needing a savior, not needing a male figure to help them figure it out. And that will also, encourage them to, like, that they don't have to endure the abuse, because they don't need to stay in those situations where they are like needing that support system, right? And then they also will teach them leadership development. So this can look like education programs, or reintegration into the workforce, helping them get jobs and stuff like that. Another big thing is psychoeducation. A lot of the women coming in are, um, they don't have very much education to begin with. So they're teaching them things about what abuse can look like, how abusers can use manipulation and gaslighting to make them feel like they're the problem when they're not. And then also the effects of substance use and trauma on the brain and body, so they can understand how those choices are affecting them as a whole. And then Another big one for women is body-based techniques. So teaching them how to reconnect with themselves, and using a lot of movement, deep breathing, um, mindfulness strategies, and then teaching them about stress management. Body positivity is a big one. A lot of women coming in have eating disorders, and they're using the substances to kind of help maintain their body weight. And then because trauma is such a big thing, they use EMDR for trauma processing, and then DBT for coping skills and managing emotions, and CBT to help control thoughts and stay in the present moment. And then community therapy is another big one because women typically are more social and they need more peer support. So the group therapies will help with skill building, healthy communication, um, and identifying unhealthy behaviors in and relationships, so they know how to navigate those in the future or how to avoid them altogether. And then they also work on impact letters. This just kind of helps them see what behaviors they're how it's affecting them, how it's affecting the other people around them. And, when they feel like they want to use again, they can look back on that and be like, why? Why am I staying sober? How is it going to affect my children or me or my family later if I decide to go back to those same habits? And then the services that are available and what treatment look like at this facility. They offer inpatient and outpatient programs. Um, They'll have people that come in through walk-in. They'll meet them through needle exchange or community outreach members that are on the street. And then they also work with jails. So people seeking treatment there, they can just go pick them up, bring them to the treatment, stuff like that. So they'll go through typically like a 3-hour assessment, and a detox period. They do have a medical clinic there with a bunch of nurses, so they can kind of walk them through that. And then the residential treatment, they do allow them to bring their children. They'll stay about 6 to 8 months, and while they're there, they'll do one-on-one and group therapies. Um, as far as the children go, they work a lot in the childhood development for the kids as well. They offer a therapeutic daycare. They do play therapy, teach them about emotions, how to talk about them, early intervention support, and then while they're in the residential treatment, they start the discharge setup right away so that the families aren't questioning, what's going to happen after, and that they're like more prepared for discharge. And then if they're they can go from residential to outpatient, or they can do just outpatient, and that's going to be about 6 months. Once they finish either of these programs, they can help set families up with sober living houses. They also have housing vouchers that, and like through Housing Connect, and then targeted adult Medicaid that can help them pay a deposit and like first month's down on an apartment so that they have somewhere to go. They'll also have a full-time case manager that'll stay with them and help them stick to those habits to prevent the relapse. And they do, I can't, I don't think I notated what their percentage was, but it was a pretty high percentage rate of people that had success and didn't relapse after the program. And then once they graduate through all of this, they are welcome back at groups anytime. They can also use the therapeutic daycare systems after their discharge. And then for aftercare support, they work with AA, NA, and religious groups, Fit to Recover and USARA, to help them maintain their sobriety. They do also have a crisis nursery in Murray, I believe. So parents that are struggling mentally, or need a break from their kids, I guess, um, or parents with special needs children, they can go and drop their kids off over here just to get a breakaway if they need to, run errands, get groceries, just have a second to breathe. They can drop their kids off and then they'll come back and pick them up when they're done. it's really good to give them a break so they can cope and manage some things. At this facility, they do have about 5 therapists and big staff of nurses. The social worker that I interviewed, she started as an intern there and she is now the program director. So there is a lot of room for growth in this this facility. If you do start out there without a license, you can be at about 65,000 and then it goes up to 75 once you do get licensed. And obviously that's just your starting, so there is a lot of room for growth there as well. Um, they also offer internships through most colleges and universities. And then a lot of the volunteers there are alumni of the programs or people that have experienced similar issues with substance abuse and things like that. And then um, they do have a lot of wiggle room in jobs at that facility, so you can kind of go where you want to go. You know, if you want to work with children, adults, men, women, inpatient, outpatient, like you have so many options, and you can rotate through until you find what will work best for you. Or if you want to work on the clerical side, you can do that as well, and they'll review to make sure documentation is accurate and care is adequate for the patients. And then um, when I asked her what the best parts of her job were, there was a lot, you know, teaching people about childcare, being a first time parent, teaching them about self-care, how their brain is working, how to navigate relationships and stuff like that. Kind of just seeing that switch and like the light come on, you know. And um, she mentioned that they have a 98% reunification rate of parents and children that are in DCFS custody. So that's really cool. Um, Working in this field is kind of hard. Um, you know, clients are struggling with substance use, and sometimes they're working with people that are doing self harm, or they come into treatment and they leave and they end up back on the street. And she said the hardest part is seeing someone that, you know, she wasn't able to reach and they don't make it. Um, and then when it comes to all of this, boundaries are the best thing that you can do, they're the foundation. Um, if you don't have proper boundaries set up in something like this, you can re-traumatize your patients or damage their ability to trust. Um, you really want to make sure that when you're sharing personal experiences, that it's for the benefit of the client and you're not just sharing just to share. Um, and then burnout is a big thing. So you want to make sure that you're prioritizing your self care, separating like your work and home life, and then just having a lot of time to decompress, especially on those hard days. So, yeah, I really had a good time interviewing my therapist. I feel like she gave me so much information, and it is really interesting to see how women and men, you know, respond differently to treatment and why they're in treatment. And I just think that there should be a little bit more research on um, women and how their, you know, hormones and responsibilities in life can affect their substance use. So, yeah, thanks, guys.